across time zones. A warm welcome to the Shadow Leading Anti-Logical Acupuncture webinar 2025. I am Johnny Song, the assistant of Dr. Guojin Huang, and I'm honored to host today's session. Before we start, I'd like to take a moment to introduce the visionary behind SNAN acupuncture therapy invented by Dr. Huang. Of course, Dr. Huang is renowned in our Of course, Dr. Huang is renowned in our field, mostly for his SNAN acupuncture therapy, and in the meantime, he is currently taking the roles of President of the Alliance of Acupuncture and Chinese Medicine of Canada, President of the Canadian SNAN Acupuncture Research Institute, and President of the Canadian Continuing Education College of Acupuncture and TCF. His pioneering work has greatly advanced acupuncture and continues to inspire practitioners around the world. So over the next 2 hours, we'll explore the innovative application of the SNAN acupuncture therapy through expert presentation and insightful clinical cases. To guide our discourse today, we're announced to have 4 preeminent scholars in traditional Chinese medicine and acupuncture. Notably, each of them is recognized as the first master of traditional Chinese medicine overseas, a title that reflects their spearheading contributions and global influence in the field as well. So first off, please join me in welcoming Professor Jisheng Hao. Professor Hao is a globally recognized expert in scalp acupuncture and has been a pioneering force in integrative neuromuscular skeletal research. He serves as the chief editor and principal translator for the Foundational Acupuncture textbook published by the World Federation of Chinese Medicine Societies. In addition, he's the vice chairman of the Education Guidance Committee, vice president of the Translation Committee, and president of the American Institute of Neuroacupuncture. And next, we're privileged to have Professor Yeman Chen. Known for his groundbreaking work in meridian mapping, Professor Chen currently holds the position of president at both the New York College of Traditional Chinese Medicine and the Neuro Foundation and National Foundation of Chinese TCM organizations. He's also serving as the honorary president of the Young American Acupuncturists of America and is the editor-in-chief of the Journal of Complementary Medicine and Alternative Healthcare. Transitioning to our third scholar, please welcome Professor Dan Jiang. A leading authority on evidence-based acupuncture, Dr. Jiang is the international chief physician of traditional Chinese medicine and serves as a TCM clinical expert in the UK. Her roles include president of the Hallam Institute of Chinese Medicine, guest professor, and clinical distinguished expert at Beijing University of Chinese Medicine, vice president and secretary general of the European Federation of Chinese Medicine Experts, president of the BUCM, European Alumni Association, and executive director of the Overseas Chinese Medicine Forum. And our next panel of experts is Professor Bing Yu. Renowned for his innovative approaches to pain management, Professor Yu is the president and director of WeMed Clinical Cooperation and serves as a medical advisory board member of the Susan G. Komen Breast Cancer Foundation. His academic contribution extends his roles to visiting professor, former associate dean, professor and clinical supervisor at the American College of Acupuncture and Oriental Medicine, in addition to visiting professor at the Chengdu University of Traditional Chinese Medicine. And completing our panel of experts is Professor Xiping Zhou. He's the president of the American Academy of Health and Wellness in Russellville, Minnesota, which is an acupuncture school offering master's and doctorate degree programs. He's also the founder and president of the East-West Healing Arts Institute in both Madison and Milwaukee. Before we proceed with our expert presentations, I'd like to remind you that your participation is highly encouraged. And please use the Q&A button in your Zoom application to submit your questions. Dr. Huang and our presenters will address these questions at the end of our session, so your insights and queries are more than welcome. In addition, I'm excited to announce a special academic promotion available exclusively today. We're offering a significant discount on Dr. Huang's online video tutorial on SNAN acupuncture therapy, and with every purchase today, you'll receive his ebooks as a complimentary gift. The link to this offer will be posted in the chat section shortly, so please stay tuned and check it out. Thank you. So now let's commence with our first presenter.
Just 1 second. Just 1 second. I noticed that
Okay.
Dr. Kenny was here. Is Dr. Kenny here?
Sure.
Dr. Kenny? Or maybe he just that drop off because she is the physician in our city, and also she is also my client. Yeah. I think that he was here, but maybe she just napped. It's okay. Let's move. Yeah, let's move next.
Okay, so let's transition to the presentations. So now I'm pleased to introduce our first presenter, Dr. Yu Wang from Winnipeg, Canada. Dr. Wang will share her expertise on applying SNAN acupuncture for chronic pain management. Her insights promise to offer valuable perspectives on managing pain effectively with this innovative technique. So, Dr. Wang, please come to the virtual podium. Thank you.
Oh, hi. Hi, my name is Yu, and I work in Yukon Acupuncture in Winnipeg. Today, I'm presenting the STAN acupuncture regarding for a clinical approach to chronic pain management. So I will focus on the innovative chronic pain treatment, the advantage of STAN acupuncture, and sharing some clinical cases. And I also present some videos from my patient regarding to their experience. The introduction of the STAN acupuncture, innovating chronic pain management. I believe the future of the chronic pain relief starts here. So what is the STAN acupuncture? STAN acupuncture is shallow needling anti-nodule acupuncture. Is an innovative therapy developed based on the traditional small needle techniques. It specifically targets the superficial fascia nodules, muscle spasm, and scar tissue to provide rapid and effective pain relief by combining the wisdom of the traditional acupuncture with the modern medical insights. SNAN acupuncture offers a unique approach to treating the chronic pain and soft tissue injuries. The core of the SNAN acupuncture relies in its patient-centered approach. So each treatment begins with a thorough assessment with the patient's condition, followed by a personalized treatment plan to their specific needs. So this ensures the efficiency and addresses the root of the cause of the pain rather than just the symptoms. So the techniques are used precise and minimally invasive and designed to restore the function and while minimizing the discomfort. Whether it's the chronic back pain, arthritis, or nerve compression, SNAN acupuncture offers a scientific-backed solution that works in harmony with your body. For patients seeking an alternative to medication or surgery, SNAN acupuncture provides a safe and effective option. It is a non-invasive therapy, which avoids the risk and side effects associated with the drug or surgical procedures. Many patients who have seen limited results from the traditional acupuncture or traditional treatment find a significant relief through the SNAN acupuncture. So it's not just about managing the pain, it's also about restoring the function, like improving the quality of the life and empower the patients to take control of their own health. Next topic, I'm going to talk about the advantage of the SNAN acupuncture, which is fast, safe, and effective. So one of the greatest advantage of the SNAN acupuncture is the fast result. So by targeting the pain resource precisely, it provides rapid relief in a short time. So many patients experience significant improvement after just one session, so making it ideal for both acute and long-term chronic pain patients. And compared to the traditional acupuncture, stent acupuncture delivers a faster and more direct result. It not only alternates the pain quickly, but also help the patient resume daily activities and improve their quality of life. Whether it is a sports injury, arthritis, or chronic pain, stent acupuncture offers immediate pain relief solution. Moreover, the stent acupuncture treatments are highly efficient, so typically lasting around 15 to 20 minutes per session, and make it perfect for busy morning individuals. And the patients can experience the noticeable improvement without the long waiting time. Stent acupuncture not only provides rapid pain relief, but also focus on the holistic healing by improving the local blood circulation, function, and tissue repair. It addresses the root cause of the pain. The philosophy of the stent acupuncture is to treat both symptoms and root causes. It all is not only alternative pain, but also regulates the body overall condition. So by adjusting meridian and nerve function, stent acupuncture help patients to achieve the physical and mental health, restoring energy and boosting the immunity. And next, I'm going to share some cases and some videos from my patient. So the first patient here, she is a nurse and she have the chronic pain on the right side, and after she write couple sentences, she will feel the whole arm is numb, and she also have occasionally headache. And this is the video after the second session.
Hi, this is my second session with the acupuncturist. I feel a lot better. I was having this pain for about 2 years now, over 2 years, I would say, because I was a healthcare aide before, and it's a physical job. And then when I became a nurse, it's more of writing, stuff like that. But after I've seen this great, I don't know how to take her, but I feel a lot better now. It's not gone yet, like completely, but you know, second session, I feel a lot better. This hand is my problem. Like I've been enduring it for so long. Even writing is giving me a hard time. Like I can only write maybe 3-4 sentences and I'm having pain and headache up to my head, you know, at the back of my head. But now I can, you know, write down good. My numbness, especially at night, is gone. And then when I woke up this morning, I'm a little numb, but not like worse. It's way more worse before. Yeah, but I would say it's good. Thumbs up.
Thank you.
Keep up.
Okay, thank you.
Hi.
And the next case I'm gonna share about, he is a guy and he is a machine operator. He suffered from the similar syndrome, so he also have the pain and numbness on the right hand side. But I treat him longer, and he's roughly around 4 to 5 sessions, and his pain level drop significantly from 8 to 2.
Good. Alright, so I had pain from the neck, the back into the shoulder, down my arm. It was so severe that I had to take medication for it, and it was really bad. The pain scale was probably between 8 and 10. And then what you did was she poked with her acupuncture needles back here, and then the shoulder. That was the first part that went away. And then she worked on my arms for the next 3 sessions, and it's each time she poked it, it would get better and better. Right now my pain scale is 1, and it's mostly just in the fingertips now. So about 90% of my initial pain has gone away, and it's just left with the
And the numbness and tingling is
The
gone.
numbness and tingling is gone. Most of the tightness is gone. The pain is mostly gone. It's just very bearable minor pains. So, good. All right. So I had pain from the neck.
Okay. So when treating the superficial nerve entrapment, stent acupuncture stands out compared to the traditional acupuncture. While traditional acupuncture has a long history, it often requires a longer treatment duration with the uncertain result. So leave patients anxiety about outcome even after 20 minutes of the needle retention. And in contrast, the stent acupuncture precisely targets the tendon point and the problem area, delivering the visible improvement within the first couple session, like a 2 session, and addressing the root cause of the pain. And the transparent treatment process allows the patients to clearly understand the number of the sessions needed and expected outcomes, significantly boosting their confidence. And with speed, precision, and enhanced patient experience, stent acupuncture is like an ideal choice for treating the superficial nerve entrapment. Next, I'm going to talk about chronic pain challenge and stent acupuncture solutions. So chronic pain defines as the pain lasting more than 3 months, significantly impacting the patient's quality of life, and is not only limiting the physical activity, but also can lead to the emotional distress, anxiety, and even depression. Traditional treatments such as the medication and surgery, while somewhat effective, often come with some side effects and fail to address the root of the cause. So many patients find themselves trapped in the circle of the long-term treatment with the diminished quality of the life. Stent acupuncture offers an innovative solution for chronic pain patients by precisely targets the pain resource, and it provided a rapid relief and help patients resume daily activity. Unlike the traditional method, the stent acupuncture requires no drug or surgery and making it safe, non-invasive, and suitable for patients of all age. Building on traditional acupuncture, stent acupuncture interrogates the more than minimal invasive technologies, optimizing the treatment process and tools. By precisely targeting the pain resource, it provides the rapid relief while minimizing the trauma and the side effects. Compared to traditional acupuncture, stent acupuncture delivers faster and more direct result, make it ideal for both acute pain and a long-term chronic pain patient. This technological innovation not only enhanced the treatment efficiency, but also paves the way for the modernization of the acupuncture therapies. And while it's a fast, safe, and effective features, stent acupuncture is transforming the way we treat chronic pain. And it's not only alternative pain, but also bring hope and a new life to the patients. So let's look forward and more breakthrough the application of the stent acupuncture in the future. Thank you.
Thank you, Dr. Wang. Yeah, for the really enlightening presentation. So before we transition to our next topic, I'd like to invite our esteemed panel experts to share their remarks and insights regarding Dr. Wang's findings. So your reflections and additional perspectives on this matter are most welcome. So please.
Dr. John, please. Thank you, Dr. Wang Yu, for your presentation. I would like to say that firstly, your slides preparation are well done. Second, the structure you laid out is very clear. So for all of us, we can learn pretty fast. That's wonderful. Number three, your presentation about efficacy of the patient is very inspiring because we do have a lot of chronic pain patients and they look for help. They tried many other therapies could not be helped, but under slant techniques and help, apparently they receive amazing results, and we are grateful for your presentation and sharing of your experience. Thank you very much.
Oh, thank you.
Thank you, Dr. Wang. It's a great presentation and it's very thorough and talk about the concept and the definition of Dr. Huang's Snan acupuncture and especially very good point about how to use the very efficiency, very safe and fast result treat the chronic and acute pain, especially myofascial pain and musculoskeletal. And also the case is very impressive. So it's but if you can do a little follow up, it'd be great. The case and to specific about a little bit of what muscles you work on, what the nerves we target will be even better. But it's a great presentation. Thank you for again your preparation and a very good PowerPoint. Thank you.
Thank you.
Can I say something? Thank you for Dr. Wang's excellent presentation. I think you gave me, I was introduced about the Dr. Wang's the new with a new therapy for shallow needles and anti-needler treatment. But actually, for you talking, let all know the characteristic. I believe this treatment, its key point is a shallow needle, means needle be put in only under the skin out of the muscle, isn't it? So this is where the needle be put on the soft tissue. You know, recently, the many new therapy, new acupuncture technology like FSN, motion acupuncture, also similar for that. So this is where I think Dr. Huang is created this treatment also brilliant. Let you introduce, let our notice, the patients always feeling better immediately. Can I have the few questions for you is, first question, do you using this SNAN treatment is if you're using point only from them or you with another normal ordinary acupuncture point together? If I can understand this treatment can be released the pain quick, such as for first lady, the numbness on the hand, and the second man is whole numbness and pain for the arm. I believe if using this NANA can be quickly release the pain, but how do you manage them general progressing? Because the patients with the pain more longer, they probably also feeling stressful, anxiety, insomnia, or something. If you managing the treatment is only using SNAN or you with another body acupuncture together, please.
So for my patients, it really depends. So for the first couple sessions, my target is gonna be on their pain. So what they want. So they want me to relieve the pain. So I will target on the pain. So after the couple session, they feel the pain better, and they told me they have problem with sleeping or something else, and I will work on that after I treating the pain because they know what they want. Like they want to get rid of the pain first. So that's the part I'm gonna target first.
How do you thinking you this SNAN work? It release the muscles bottom or have another pathology or another explanation?
So it's like this. So for the case I shared in the video, so they have the pain, when they just the first time they saw me, they say the mostly is the numbness. But when I'm palpating them, I feel the pain on the elbow and on the shoulder, and I also find on around the C4 and C5. So I open the scar tissue and nodules at all of the area, and they will feel better right away after I doing it. And after I will see them after a week or a couple of days, and they're gonna come back. They will tell me the pain rate is lower down. So not only treating the problem on their numbness for the finger and the wrist, I also gonna check the areas like above, like where happen, like where compressed, and then I'm gonna open the area where it's compressed.
You know, your side is release noodler. Is this noodler? Can I understand that is muscle spasm? Or if
It's
do
the
your
nodules.
needles can be making despair for all of noodlers?
Mm, it's the nodules. It's the nodules where like I'm opened it because it's compressed on the nerve. That's why they feel the numb and tingling.
Okay. You know, I can understand nodular probably is a muscle spasm. So this is where when we manage our treatment is strong and good enough, can be released muscle spasm. So this is where despair for the nodulars. So this is where they working effective quick. Thank you.
Another question I want to ask you that do you use this NAN technique to treat some of the internal medicine problems, such as maybe the person has stomach pain or ulcer in the stomach? You ever tried? I understand it's focused on the soft tissue injury or pain.
For the stomach pain, I don't have any patient have stomach pain to me now, but I have one with the rib pain, which is
Mm-hmm.
on the right side, and then they told me that I have rib pain, and so when I'm checking, I found some scar tissue on the spine, on the spinal. So I open there, they feel the sudden relief of the pain on the ribs, but yes.
Thank you.
Yeah, I do have that,
Okay.
you know, that maybe that use the snare needle for stomach pain, you know, cases. Actually, I treat actually, and there are lots of patients, you know, that come here for chronic, you know, that stomach issues. One patient very impressed me is that he come from States actually. He was a refugee from Afghanistan, but his daughter and daughter-in-law live in Winnipeg, but they live in the New York cities. That person, you know, that he had scoliosis, very, very serious scoliosis, and also shape, the body shape has been, you know, deformed. And he's that, you know, the pain on the stomach, typically that the underneath of the rib side, and has been over 3 years. Actually, that he did all the exam in the States, and you know, none of any positive, you know, sign or anything found. Just the doctor just don't know how to treat it. And then that because his daughter-in-law, you know, was my patient, and then that yeah, when the man come from that, you know, that state to my city, actually that second day with me right away. And I found it is very interesting though, because you know when I check up his, you know, that abdominal part, very sensitive, very sensitive around the, you know, rib side, and also that on the abdominal areas. Because from my knowledge, I know that could be that caused by the trigger points around, you know, that the levator abdomen, you know, that the muscles, because these muscles can cause lots of chronic pain issues, but actually nothing wrong from stomach. You know what I mean? And then that I just checked up, and then that I found, yeah, lots of trigger points there. And also from the back part, maybe around, you know, for example, T78, you know, that correspond to the front part. Also around spine areas, some kind of trigger point, very, very sensitive. Yeah, I just use the snare needles, you know, and quickly to release that. After the first day, and then the second visit to me, told me his stomach pain 90% better. So actually that not just only one case, actually I treated lots of patients from stomach issues. I found right now, yeah, if nothing exactly happens in stomach itself, but always patients show the stomach issues. That could be from that all these kind of trigger points from those kind of muscles or all that kind of, you know, the soft tissues, including fascia. Because, you know, the patients experience, you know, the symptoms just like stomach issues, but from exam, nothing happened. So that is very, very interesting issues, you know. So I would like more, you know, that the doctors or therapists, you know, be aware of this kind of, you know, that the symptoms. Yeah, because it is very, very common right now, you found, even that IPA's patient. I found the stomach, some muscles, some trigger points very sensitive. When just a little bit press it, it's very painful. And then you know this pain not from stomach inside. Actually, if just a little bit touch, the patient feel pain already. That means that trigger point could be the cause of stomach pain. So you just use the snare needles, find those nodule to break up those kind of that trigger points, and then the pain will be gone right away, and then symptoms will getting better right away. So even yesterday, I treated one that Ukraine girl, only 16 years old, and she suffered from the IBS. I found her left side, you're very, very sensitive. Even a little bit touch, she can tell me lots of pain there, lots of tenderness. You know what I mean? And then that I just use the sun needles. When she get up, wow, feel much release, feel much better. So that is could be that answer, that I just, that with Dr. Wang's, the case, because he just started his practice only 2 years, right? Yeah, she's my student actually, and actually that I'm proud of her that actually that she knows how to perform the snare acupuncture already, to treat her patient. So that's good. Yeah, this is my answer.
Okay.
Thank you, Dr. Huang, for sharing.
Let me say something. No. Hello?
Yeah, sure, please go ahead.
Yeah.
Yeah, sure, please go ahead. We can hear you.
Okay, so I don't know what happened with the no camera. So I think I'm the first one to raise the hand on Zoom screen, but I'm waiting for it's okay. Yeah, thanks, Dr. Wang, for a very, very well presentation and gave us the big picture of the snare acupuncture. Yeah. Also, I like to thanks Dr. Wang and has innovation for the tool for the acupuncture needles. They have very popular in China, has the small needle knife and also focus on the structural acupuncture, but has to because a lot of the knife is thick and also it need anesthesia and before the procedures. But this one doesn't need it. So it's more applicable in the North America. So as a licensed acupuncture, we cannot use anesthesia. So in case work together with anesthesiologist, that's much more expensive, right? Second, I think that's a very good the theoretical breakthrough. We know in spiritual pivot, they have several chapters, 4 chapters, talking about meridians. One is channel diversion, channel collaterals, and Jing Sui, right? That's the channel water. And the one important chapter, channel sinew. So channel sinew, including the as its description, including the nodules and the symptoms. So that's the different pattern. So now, according to the anatomic musculoskeletal anatomy, and find certain is the dry needling, but their needle methods are different. But this one is really and can keep the track of traditional medicine as in the modern times. So it's a great methodology, and I hope we can promote these methods in North America. Thank you.
Thank you, Professor Chen. And also thank you everyone for your reflections and really engaging discussions on Dr. Wang's findings. So
I would maybe that at the comments for her the treatment, the studies actually that I'm so impressive actually that these 2 cases because that all the tingling, numbness, of the hands, that means that the nerve compression, symptoms, because traditionally as we are, the Chinese medicine doctor and also acupuncture therapist, when we treat those kind of nerve compress, actually it is very hard. honestly, that before I start my snare acupuncture, when the patient tell me that, they have tingling numbness on the hands, on the feet, actually, I don't know how to treat them at all, because traditional acupuncture almost doesn't work. That if you just choose points by differentiation of symptoms and signs, and then to treat those kind of tingling numbness, it is hardly to achieve the result right away. Maybe you have to take maybe around 5 or 10 sessions, and then to achieve some improvement. Because we also have a word we say that in the pain clinic, relatively we say pain is lighter, and tingling is serious, and numbness is more serious, than the pain issues. That means that the pain relatively easy to get treated. But when patients have tingling and numbness, it is very difficult to get treated. But from her treatment, these two cases, that achieved a very good result. So that's really that. I mean that it's advantages of snare acupuncture for this kind of issues. Yeah, so that's why that's kind of the comments I will add on top of her, that the case studies, because it is that very impressive. Thank you again, Dr. Wang. Thank you.
Thank you.
So thank you, everyone. So moving forward, we will now explore some practical applications through real-world clinical cases, and I'm pleased to introduce our next presenter, Dr. Maggie Jing, also from Winnipeg, Canada. Dr. Jing will present case studies demonstrating the use of snare acupuncture in addressing chronic sinus congestion, plantar fasciitis, and post-surgery hip flexor tightness. So Dr. Jing, please come to the stage.
I'm going to share my screen with everybody. Can you see it?
Yep.
Okay, good. So my name is Maggie Meixiong Jin. I am a registered acupuncturist and also registered massage therapist in Winnipeg, Manitoba. And I provide acupuncture service and also massage therapy service in my own clinic, Jin Acupuncture Massage Clinic. So today I'm so excited to share a case study on shallow needle and anti-nodular acupuncture based on two case study from my practice. From now, I'm gonna call it snare acupuncture. It's easier to pronounce for me. So first of all, I want to thank you, Dr. Huang, for this opportunity, and I appreciate the chance to share my experience with all of you and also learning from others too. Actually, snare acupuncture has had a huge impact for my clinical practice. So before that, I dive into my case study, I want to share a little bit story and how I got into the snare acupuncture. So I remember, I think it was around 4 or 5 years ago, Dr. Huang gave us some lectures at the Manitoba Professional Acupuncture Association. So he shared his knowledge and explained the technique and even showed videos of patients' feedback and treatment results too. So got me interested in about the technique. So I registered online courses. So I finished the online course, and then I started to apply this snare acupuncture on my practice. So help with patient with pain management. So I got some good results and with pain management, but I also had a little bit challenge here and there and had a lot of questions. And so sometimes I couldn't really locate which nodule I want to work on it. So anyways, I want to give some example for saying when I treat front of neck and the thoracic area and on the chest, and I was scared of just directly apply for snare acupuncture. So what I did is I just lift the skin and put the needles in. I know it's not the best approach to apply the needles, the snare acupuncture. So last year I had a chance to take some clinic training part. It was 5 days course. Oops. Sorry. So it was a 5 days course, and I like the structure of the course. Every day in the morning we had a lecture. In the afternoon we followed Dr. Huang to see patients and also see how he takes the intake and how he locates the nodule, how to find it, and we also able to feel it when he was treating patients. So after we also had a chance to practice on each other, we had a few therapists at the time. So by practicing on each other, we were able to give each other feedback right away, and also was able to test what is depth like and what patients are experiencing during the needling. And it was giving a better idea for me. So I was more confident to explain to patient and what they're gonna experience before and during and after the treatment, because I tried it on myself. I know what it's gonna be like. So patients they trust me more by me explaining more details to them, and I made them more comfortable before treatment. So our hands-on experience was a big game changer for my practice, to be honest. So I personally highly recommend if anybody want to take this course, and the clinical part, you can miss it. So yeah, go for it. So now I'm gonna share my case studies for Senen acupuncture. So first one is Senen acupuncture for hip flexor tightness and plantar fasciitis. And second case study is gonna be sinus pressure and the chronic nasal congestion. So the first patient was 38 years old male, and he had a hip flexor tightness and plantar fasciitis. And so he had both hip surgery I think it's 2018. And after that, the tightness and the pain on the feet was ongoing thing for him for years. But he was born with some issue with his hips. Apparently he was explaining to me his hip is like bone and bone, and as he was growing up, it got worse. So he was working as a police officer and previously carried like over 40 pounds of equipment on his waist, and that was putting a lot of pressure on his lower back. So it didn't help after surgery either. So, and he's eating healthy and sleeping okay and doing regular exercise 3 to 4 times during the week, and included weights training and the stretching training too. But now he changed to the sitting job, sitting on the computer a lot. But as we know, and the sitting is not good for your condition either, and it's shortening your hip flexors and also weakening your stomach muscles and also your glutes muscles and the hamstring. So he told me he's constantly stretching during the work, but it's very tight. So previously he had a massage treatment included from me, and then when he came in for massage, it was first time I was seeing him for massage. So as I was doing massage on him, and I palpated a lot of scar tissues and nodules where he had a surgery, and some tightness on his iliac crescent area, and his stomach pressure was very high. So I just suggested him if he want to give it a try for Senen acupuncture for potential solution. But he told me, he said he's scared of needles. So I explained to him how different, it is a little bit prickly, but it's different than the traditional acupuncture. The needle is not gonna stay in you for 20 minutes or something like that. It's gonna just go in and out. So he said he will think about it. So our first visit was done. So he booked another massage session the following week. So he came for massage. He said he made his mind. So he want to give it a try. Nothing to lose, he said. So I said, okay, let's give it a try. I'm going to give you massage first. In the end of the massage session, I will leave 10 minutes and just to do quick Senen acupuncture on you. So I found those all the trigger points and his abdominal muscles and also hip flexor. And he also had a tight IT band and glutes muscle and QL. I worked on, and also medial ventral line too. So after Snell acupuncture, he couldn't give me right away feedback. In head and his body, it was so stressed from the needles I did. And all he telling me, he was like, the sensation was too strong, but it was tolerable. But I can see he at some point he had a little bit sweating. So I said, it's okay. So you're coming for once a week massage session. So we started to try 3 times Snell acupuncture. That's in the end of your massage treatment. So he agreed to it. So that was our first treatment. And so I sent him home. I said, just monitoring it, and when you come back, give me some feedback and see how you feel. So following week, he came back for another massage session with Snell acupuncture. And the minute he just walked in, he was like, you know how much relief he got? And he said he never had that kind of relief since his surgery. So I was surprised, right? And so I said, okay, that's good. And we keep going and try a couple more treatment and see where we at. So here's additional information he gave me. Is he said he had some like good sleep after treatment, and also better with his digestion, because he didn't mention about his digestion was a little bit poor, but like it's what he told me after first session. I think it's because of I also worked on his release the nodule around the iliac crescent and release the pressure, and also did the abdominal like oblique muscle and right below the rib area. So by me releasing those nodules, and it's doesn't put too much pressure on the stomach, like the fascias around the stomach. I don't know, like maybe I will ask Dr. Huang jump into this conversation. Jump into this and give you guys more explanation. He already did a little bit at the beginning, so I will just leave it for him later. And the third visit, he came in for another treatment, and he's so satisfied with his result with his hip flexor. So now he gave me different issue. He said his right calf muscle tight, and he has pain at the bottom of his feet, right foot. So I said, as you experience it, the needle, sometimes it can be a little bit pinchy. So if you're willing to, we can give it a try. So he said, okay. So we did a hip flexor again. And then I moved to his right leg and find the trigger points and treat it around gastrocnemius and the soleus muscle, and also trigger points on the peroneus longus, the medial arch area. Palpate just the trigger points and the tender area. So this time he gave me immediate feedback. He said when he get off from the treatment table, he didn't feel any pain on his foot. So I was like, okay, that's good, but like let's monitoring it for until another visit and see if that effectiveness is lasting longer. So I'm seeing him every 3 weeks now, just for the maintenance. And it's been a while. He hasn't complained about his feet, and but his hip flexor is getting tight here and there because he's sitting a lot. But he's very happy. So we are doing just every 3 weeks for a follow-up visit. So before learning Snell acupuncture, I primarily use like traditional acupuncture and acupressure and scraping or like fire cupping for this condition. And while at this method, it provides some relief, but I required more like frequent treatments. Sometimes you might want to see them like twice a week. And then pain often comes back afterwards. And in contrast, like a Snell acupuncture delivers faster relief with longer lasting results. So I think because Snell acupuncture is directly working on the scar tissue and the adhesions and release the fascias, which are causing like his flexor tightness in this case. So overall highlights the potential of Senen acupuncture in chronic post-surgical tension and the pain. So second case study is Senen acupuncture for the sinus pressure and chronic nasal congestion. The patient is 50 years old woman, and her primary complaint is anxiety and depression. She's coming for regular acupuncture treatment. And one day she came in and she said that she has some sinus issue. So she's been having this chronic sinus issue for a long time. And usually it happens when she gets cold, and also when she's not feeling well or weather changing and allergy season comes and it acting up for a couple of weeks and no more than that. But this time she had a cold, but this she already over with her cold, but her sinus was still bothering her, and also nasal congestion. So it lasted more than a month, she said. So her left side was more affected than the right side. So she also was mentioning about the mild headaches on her forehead. It's a pressured sensation. So, but when she mentioning about this condition, I already finished the 30-minute treatment with her. So I didn't have another 30 minutes just to help with her sinus issue. So I said, also Dr. Huang mentioned about some therapists helping with sinus issue with Senen acupuncture. So I said that there's some different technique if you want. It's not gonna take too long for us do it. So probably 5 to 10 minutes. So patient agreed to it, and I started to palpating around her face area, and her facial muscle was so tough, and you can feel it's like a rubbery. There's no elasticity, that kind of feeling. And so I palpated around and chose the few trigger point points and tender points. And I applied the needles, and I didn't do too much. I just did a few areas, and then where it's mostly tender points. And so after acupuncture, and she felt much better. She said that she can breathe better, and she feels like she has more room in her nose, and the sinus pressure is better, and she had no headache just right after the treatment. So, like I said, she was coming regularly once a month to see me. So a month later, she come back, and she reported that her nasal congestion had significantly improved, and with only a slightly sensation on her nose area and middle eyebrow pressure. So still more on her left side than the right side. She barely felt any feeling on her right side. So she was very happy with the result. So I was, even second visit, I said, okay, it's working. I keep trying it, right? Experimenting it. So I want to see and how it's gonna work. So I keep applying the same method, repeated first treatment, how I did it on her face. So third visit was another month later, and she continued her regular session for her anxiety and depression. And in the end of the treatment, I did Senen acupuncture again. So she said that it's almost completely resolved. She doesn't feel tiny bit, but it doesn't feel any discomfort. So 3 months mark, and she was continued receiving monthly treatment, and her sinus condition remained stable and no significant complaints. And 5 months mark, and even though a lot of people come from Manitoba, and we had extreme weather, from a slushy weather to extreme cold, -40. And she said that even those significant change in the weather, and it hasn't bothered her nose that much. And still feel a little bit when it's very cold, but like nothing like before the treatment. So the effective of Snan acupuncture is just a few sessions was surprising, and it's encouraged me to experience more. So I started to apply for other patients who randomly just come up with like saying, "Oh, I have sinus issue, and can we do something?" So I actually tried a few cases and got a good result from it too. So at this point, people are might thinking, okay, then what did you do before you learn this acupuncture? Yes, of course, we can. We have to follow our roots, right? And you gotta do the differentiation and diagnose and where it's from. Usually, chronic sinus congestion indicates internal imbalance related to weak organs function and Qi deficiency or blood stagnation or damp phlegm accumulation. So usually choose related acupoints. And for me, I do traditional acupuncture, and I also did some acupressure on the acupoints. And I also educated the patient go home and do the acupressure for themselves. I also did sometimes do scraping on their neck and SCM muscles and help with lymph drainage aspect. So the effectiveness is good, but my session usually take almost an hour, sometimes more than an hour. So effectiveness is there, but the session is too long. So, but like for Snan acupuncture, it's short and quick, and so in 5 to 10 minutes you can get a very good result. So why not, right? So tightness in face and the neck muscle can obstruct qi and blood flow, leading to stagnation and phlegm build up in the sinuses. So this is related to muscles, and you can palpate and find the tender spot to apply needles. And releasing tensions with Snan acupuncture can improve sinus drainage and relieve congestions. So Snan acupuncture may be an effective approach for the chronic sinus pressure and congestion, particularly when the patients have tender points in the facial area. Sometimes they can tell you like, "Oh, that's so painful," right? So, but in the other hand, doing Snan acupuncture on the face, it is quite painful. So usually you make your clients crying, and also it's easy to bleed. So you need to hold it longer, and you need to educate patient, and you don't want them get stressed out after your treatment or during your treatment. So I would love to hear if others have similar treatments and their experiences on these conditions too. So I don't have videos. My patients are all shy and like me, so we couldn't do the video. But there's a first case study, and my patient left Google review for me, so I said put it on here to share. So that's my presentation, and thank you for listening, and thank you for your time. If anybody have a question, you can ask me.
Okay, thank you, Dr. Jing, for sharing these compelling case studies. So at this juncture, I would like to invite our panel experts to enrich our discussion, by offering their insights and interactions on Dr. Jing's presentation and achievements. So please go ahead.
Okay, thank you, Dr. Jing. Very good presentations.
Thank you.
Because it beyond the musculoskeletal disorders, and you also had those kind of allergic sinus problems.
Mm-hmm.
So my question beyond the musculoskeletal problems and this sinus problem, any other indication you use in your practice using Snan acupuncture?
Sorry,
Do you have any other indication
Mhm.
in your clinic you have used snare acupuncture, which is not related to the musculoskeletal problems?
Okay. Like a headache. If they have like a migraine, I usually actually that's also related to musculoskeleton condition because
Neurological, yeah.
right, yeah, you are relieving the tension at the back of the occipital line, right? So that's also
Internal organ disorder or something other
internal
thing?
organs. That for now I can't think about it.
Okay.
Yeah, mostly like I helped with patient with pain management using this.
Okay.
Yeah.
Okay. Thank you. Thank you.
Thank you.
Can I say something? Thank you,
Yes.
Dr. Jin. Excellent presentation.
Thank
And
you.
also gave the two significant case study. But I just noticed, especially the second one, the patients after your treatment, keep 1 month the good work. That is brilliant. So I understand your technology is if do these needles, you always have to looking for the male facial trigger point. Then put needles too, isn't it?
Yes, I just
Yeah.
palpate around like her complaint area or cheek and also jawline and also like under here and I palpate like a tender spot and I release that. Yeah.
You have to put many needles, not only for couple of needles.
So on
Very
one,
shallow
sorry, yeah, go ahead.
for many needles or only couple of needles.
So
Many.
first fish visit, I think I did a 5 needle on one side because I was kind of pressured to apply this needle on the face. If I'm thinking of it, I don't want people putting like a snake acupuncture on my face either. So I was afraid of it. So I only applied 5 needles, yeah, on one side, each side. So 10 needles in total.
Do you do one side or both side?
I did both side. Her complaint was both side, but her left side was worse.
I see.
Yeah.
I have a question is because for this this new technology treatment is with a snail treatment, but this treatment you main paying attention more to looking for male facial trigger point, but not actually. Before have this new therapy, most of people need to looking for trigger point. Trigger point means any pain place, we just put needles in.
Yeah.
Can you tell us, has any different this male facial trigger point and initially the old trigger point?
Okay. Thank you for asking this question. Actually, I forgot to mention about it earlier. So when I'm treating like a face or hands or feet, those sensitive area, I started with acupoint like trigger point because I want to do as less as needle I want, and I want to see the result first. Then after I go second palpate and see if there's more areas I need, more nodules I need to release. So I think it's patient feels more comfortable that I don't have to do too many needles. And sometimes I feel it could be not the it's causing the pain original where the pain started. So yeah, now when I do like those sensitive spot, I usually do find the acupoint first and do this fascia point. But other area, I usually palpate it first. If there's a lot, like first thing, glutes and the lower back and the shoulder, I palpate first, and I just release where I feel like it's tensed up and then nodule. Then I ask, go second round, and I ask the patient where do they feel pain. Yeah.
If you put needles, always very shallow under the skin only.
Yes. Yeah.
Thank you.
Thank you.
谢谢美香 very good job.
谢谢。
Your presentation is very clean, nicely organized. So good work.
Thank you.
And also you share with your story to start with learning Dr. Huang's innovative techniques and technology. This is very, very helpful because I'm very impressed by this technique that the fast results and also scientific methods. What does it mean? That means as a clinical practitioner, when I was in the medical school, always my professor told me, said that if you know anatomy very well, you know 50% of medicine. So the point that Dr. Huang innovated this technology immediately help us apply this technology for the clinical treatment. And your presentation and well present the case, such as the first case is the hip problem with the police officer, with you are able to identify many of the joints and muscle groups. Very impressive. Good job.
Thank you.
So second one, your sinus treatment, it's opening our eyes because this technique, from my understanding, a point that's definitely it's very helpful for internal medicine problems, just like Dr. Huang, Professor Huang explained a moment ago. But one thing I want to ask you is that so you treat this patient over 1 hour. How did you lay out the payment fees? How much the patient need to pay?
Okay, so for him, it was like I do 1 hour acupuncture sorry, 1 hour massage session, and I charge additional $25 plus GST to his massage session. So the session itself, I do 50 minutes massage and 10 minutes acupuncture, but in 1 hour I finish this treatment. So it's more than an hour massage session, yes.
So you basically spend your whole hour time with just this patient.
Yes, for this patient, he's my massage patient originally. He's not my acupuncture patient. So it's why he started with massage. He liked massage. He wanted to keep coming for massage, but he also wanted to do the acupuncture. So yeah.
I just want to make sure from practice standpoint and business standpoint, you got well compensated. Okay.
Thank you so much. That's a good point. I might change it.
Well, you have to.
Yeah,
you have
thanks.
to because the value you provide is significant.
That's right. Yeah. Thank you so much for the pointed out.
Thank you.
Yeah,
You're welcome.
thank you.
And is Dr. Zhou is still there? 周教授在吗？ Okay, so anyway, that I would like to maybe add the one that maybe comments, that to Dr. Jin's, that presentation. And first of all, thank you very much for your very wonderful, the presentation and the very organized, slides, very clean, very, that professional. And yeah, for that, snap puncture for, the nasal, congestion issues. And it is quite, that surprise to me too, that time when my student, he told me, actually, I don't know before when I teach, I teach these techniques, that I don't know this, treatment, snap puncture can help, the sinus issues. And then that when my student, that in Vancouver, she sent a message to me that he told me that Dr. Huang, that I use snap acupuncture for sinus works perfect. I said, how to use that? I never think about that, the snap acupuncture can help that part. Oh, she said, you told me how to treat the patient, and then I just follow your way. But I say I never told you how to treat the congestions, nasal congestions. She said, oh yeah, just that find those kind of trigger points around the face, typically around that the nerves and all the checks and some kind of muscles. Yeah, and I said, wow, that's a good idea though. And then the time that Dr. Jing that was in my clinic, I just mentioned her. I say, yes, I have some patients to do that. Actually, I also did some treatment for my patient with sinus too. It seems works very, very good. And then this let me that recall that a few years ago when I treated one patient, actually that lady, she has suffering from the depression, anxiety, but she had, fascia, that hyperactivities, muscles are always, just like, that the muscles, twitching, of the face, and then the time I didn't know how to treat this part. I only treat her the depressions. But every time I treat her depression, her face, moving, muscle, twitching, makes me so uncomfortable. And then I say that, can I treat your muscle twitchings, of the face? So why? Yes, because he suffered very many years already. And then that I just use my way, find those kind of twitching muscles. I found this tender. Oh yeah, very sensitive. This tender. Oh, very sensitive. I just use it just very quickly, very tightly, to tip it. And then after 1 week, the patient come back. Her face muscle, much less. She's so excited to say, hey, doctor, sell me because my muscle twitching has been over years, that nobody can harm me. And then just one treatment, he feel almost 80% better. That even the result even better than the depression treatment that had been treated her almost 1 month, And then the second time I treat her again, just find those kind of trigger points and then achieve the right away result. So, and yeah, so that's why that I say that I would like to take this chance, that to promote my techniques because can open our, that eyes of our mind, because we can use very tiny needles, can resolve lots of problems, which we couldn't, resolve by our traditional acupuncture because our traditional acupuncture the series, we don't have any issues, to mention how to treat those kind of patients. Of course, yeah, when the muscle twitchings, we always say, okay, because liver wind, that the movement, and then we try to use some acupuncture points, to calm down, those kind of liver wind, or that to, decrease the heat of the liver meridians. But most of the time, it doesn't work at all. But when we try to find those kind of trigger points directly to treat those kind of targets, the result right away. So that's why that I really need that that people to understand more that our the slang acupuncture and understand more the trigger points series because the trigger points that series has been studied over almost 100 years now in that that in United States and European countries. This is really based on that anatomy and also lots of research of the pathophysiological research indicated that we can do the best result than just traditional acupuncture for this kind of issues. Of course, traditional acupuncture works very well for women, issues, for that the internal medicine issues. Of course, that the meridians, acupuncture points, still works very good. But for this kind of, the musculoskeletal, disease, I think we need, use our, modern and updated knowledge, to enrich our knowledges and then to open our eye. Okay, because our world right now that we have lots of, challenges need us to, to help patients resolve the problems. Yeah, so that really that I appreciate, Dr. James present, that her that, presentation that, to treat the nasal, congestion. That is very, very, that invaluable, that ideas, for lots of issues. Actually, also right now I use lots of, this, snake acupuncture to treat lots of ENT disease, So even that the migraine headaches, that even that the vision issues, and also the the tinnitus and the deafness, I found 50% of those patients we can help them use snake acupuncture instead of traditional acupuncture because we can achieve the best result and shortest result right away instead of that they have to spend that maybe months of treatment. Maybe the result is good, maybe the result is not good. Yeah, so that's the is my comment. Okay, thank you. Thanks again for
Thank
Dr. Jiang,
you.
Dr. Yubin, and Dr. Jin.
Thank you.
Okay, thank you everybody for your eye-opening reflections and interactions. Next, to conclude our series of presentation, we now invite our third presenter today, Dr. Kimberly Perry from Toronto, Canada. Dr. Perry will discuss her hands-on experiences and provides insights into using stand acupuncture for managing TMJ disorders. And Dr. Perry, whenever you're ready, please come to the limelight. Dr. Perry? Okay, there you are.
Hi, nice to see everybody. I'm excited to be here today. It's a beautiful day, and I feel honored to present this topic with Dr. Han. It's been a game changer for my clinic and just people that I treat. So I just feel truly blessed to present this topic. So we're gonna go on. Oops, sorry.
Sorry, take your time.
Sorry, just one extra second here. Okay. Go. All right, so my topic I chose was TMJ pain management. It's a very common thing that comes into clinic, people being very tight, especially with today's stresses, a lot of computer work. There's always a struggle with kind of clenching. I mean, we're eating everything we do with our life typically. So I've been practicing for 17 years. I do massage therapy and acupuncture. I generally integrate Western and Eastern methods of treatment for comprehensive care. I've really enjoyed doing the blend of treatment because I find it's very successful. So I trained under Dr. Huan in August of 2024. And it was just the best course I've ever taken. I've taken tons of courses over the years, but this one just seemed to be the most successful with just treating acute chronic pain, people that had restricted mobility, nerve compression. And it was just so immediate. I found typically in treatment, I would be treating for an hour, hour and a half, and they would have to wait the 24 to 48 hours after sometimes to get the immediate relief. And so it was great that eventually the benefits came, but I wanted something more immediate. So I was drawn to his technique. And when I went to the course, I just absolutely loved it. So typically with TMJ dysfunction, you have misalignment of the jaw, you can have musculoskeletal tension. A lot of it's stress related. If people are clenching and kind of grinding in the night, they might have had injury, different traumas, postural imbalances. A lot of people on computers, you could be forward pressure. So all that stuff kind of played into the head. And again, just overuse of the muscles with chewing. A lot of people with maybe their jobs, they have excessive speaking. So it's just kind of an overuse that ends up happening. So you can have scar tissue that builds up. You can have overdevelopment of some of those muscles in here, the masseter, just from constantly chewing and grinding. So with that, you get adhesions that build up, maybe scar tissue from injuries. So typically in treatment, you're doing you can be doing massage, chiropractic, osteopathic care, physiotherapy, medications. A lot of people, anti-inflammatories, surgery in cases where it's very severe. But I just wanted to have something that was just quicker where we could really target those adhesions. And again, the traditional acupuncture was great. I found I did have results with that. But again, it wasn't as immediate. And even though they would feel nice at the time, they would end the treatment and still maybe have clicking and, still feel kind of that tension in there. So when I started doing this non-acupuncture, I found it, they would immediately feel a change. And they were surprised by it. So a lot of the patients end up calling it the wow technique, and just that it was a miracle because of how much it would drastically change their life. So with the protocol, you're looking for those tender nodules along to release that muscle tension, or just very high tension points with referral patterns like those myofascial trigger points. Again, there's those adhesions, so you're trying to find where there might be kind of those stuck patterns. And then just to bring that mobility, a lot of people, if they can't even fully open their jaw or it opens uneven, and again, you're releasing those superficial fascial nodules for improved tissue function. Again, that scar tissue that kind of prevents some of that movement. So one side might be totally stuck, the other side open. So with that, you're creating pain just by that inefficiency. So treatments typically with this non-acupuncture was 2 to 10 minutes, which again, when you're used to treating for longer, it was really nice to have something where someone could come in feeling pain right away, and within a couple minutes, it saved months and months of what they've been going through. So they really felt heard, I found, with their treatments. So it was really nice to get that immediate result. So, with the treatment method for this non-acupuncture, you're going into that palpation. So, finding those tender nodules or restrictions in through that area. You're using this special needle. So, with the blade assistance, it's a longitudinal blade that cuts the abnormal hyperplastic nodules and adhesion tissues. So it's quite accurate, which is nice. So the typical needle, again, would be helpful, but when you're dealing with the fascia and the fibers, having the longitudinal blade really makes a difference in being more precise with the technique. So I found that, again, really made a shift into how people felt afterwards, that they don't have the tenderness that might follow up with massage, traditional acupuncture, that type of stuff. So again, for precision identification, you're pressing the nodule with your thumb or your finger for a couple seconds to separate it from the normal tissue and determine the exact location. For the needling technique, you're inserting the needle and moving it up and down in a fan direction to kind of break up the nodule. Because again, if we can look in those areas, you can see how dense some of it is. So there might be quite a bit of layers to that. So by moving it slightly, you're able to kind of get into that pattern to really free up that space and those restrictions. The insertion process, you're typically doing maybe 2 to 3 insertions per nodule. I find you start feeling it kind of shrink and it might move a little bit. So that's where the multiple insertions come in, is that you're continually, almost, I'll say, following the pain or search and destroy mission, where you're getting it and then you might have to just move slightly to kind of make sure you're getting the entire area. For depth control, general insertion is about 0.3 to 1 centimeter. So you're really not going very deep. So especially when you're dealing with facial points, again, it's so vascular that you're not going deep. So that's what was great with this, is that you can be super shallow and having that really good effect without having to worry that might come in with other processes. So for auditory feedback, you're moving it, and it's quite interesting because you actually hear the crunch. So for patients, it's very satisfying because it's like, oh, that was the one. They feel that you're hitting it exactly. And so you stop the deeper insertion when the crunch sound disappears, because it's almost like going through layers of tissue paper where you can feel that kind of shift through it. And I found you notice that with traditional needling. But this one, again, because of the blade and its perfection, it's a little bit more targeted and efficient. So the completion for treatment is usually when the nodule flattens and disappears. So that's usually immediate once you kind of put that in, maybe again a couple times, and you just feel it dissolve, like it's just gone. So the patient feels it as well. It'll be a pressure and then it's instant release of pressure. So they really enjoy it. And so it's fun hearing people when they're getting it, because they're like, oh my God, like you did it. Like this has been driving me nuts. So especially we're using our jaw all the time. So you can imagine if you're talking and then it's clicking, and you're eating and it's, you're hearing all the grinding, and it's just, it can be very painful and annoying to people. So it's nice when they can immediately move their jaw after and be like, oh, wow, like I actually don't hear that clicking sound that I hear every time I move my jaw. So for the benefits, again, we're getting into that immediate pain relief. Tenderness is gone. The nodules they feel are completely almost gone. They have improved jaw mobility. So that enhances that joint articulation. Because again, if the muscles are tight, the joint's not moving properly. So you're reducing the tension restrictions, and that jaw clicking again when opening and closing is gone. Decreased clenching. Again, if the muscles are tight, they're almost stuck in that contracted pattern. So when they almost experience a liberating sensation, when they get an instant reduction of symptoms, that it's like, oh, they're not feeling it pulling on them, because then you're getting into the neck and to the shoulders. So with that, then they have reduced tension headaches, because a lot of people with jaw problems, they have headaches even into the eyes, because if you think of the facial nerve going across, you have those usually affecting those other areas. So once you free that up, you're not having that, entrapment or compression that can sometimes happen in there. Increased cervical spine mobility, you get range of motion in the neck. So I find typically just with the innervation to affect those areas, I usually always like to treat the back of the neck, C2 and up through the occipitals, because it's so tight. And that will kind of pull things forward. So once we free that up, that also helps all that innervation through the face. And then with that, once you're freeing up those restrictions, you have enhanced energy flow. So there's a whole freeing of upper body restrictions and promoting overall balance and well-being. So it's really nice to see that instantly, where people can start feeling like, wow, I can actually feel flow into my arms and legs because of these upper restrictions. If ever it, prevents that flow moving downward. So general precautions when you're using this non-method, there is sometimes the pain, so there's potential discomfort. So some people it may be a bit painful, but what's great about it is the pain just subsides immediately. So in my clinic, I have kind of my little expression of short-term pain for long-term gain, because people, again, they might have had this for years and years of discomfort. So if you take 1 second of, oh, and then it's gone, well, that's the long-term gain. And then you don't mind that quick second that it takes. So I found for people that were apprehensive with needling, the thought of not having needles that were retained into the tissues, again, made it a little bit easier, that it was quick, one and done type thing, or that they would, if I did combine it with other ones, if they were nervous, and then sometimes I would combine more traditional Chinese medicine points just to help with the anxiety, kind of get the flow going, relax the body. And then I might go into some of those other points so that by the time I get there, they are feeling relaxed and more calm. So it really worked out in either way you're doing it. But I always like to warn people so they're not startled. I also like to warn them as well with the sound of the crunch that they hear, because especially when you're doing around the temples and here, you can hear it almost better. And especially at the back of the head, you might hear more of the crunch. So I like to notify them so that when they hear, they'll not like, oh my God, did something just happen? They know that it's like, oh, that's part of the process. And besides that, they actually feel good, so they can be confident in hearing it as well as feeling it. There is sometimes the minimal bleeding, very, very slight at the insertion point. You might notice at some points, but it just goes away instantly. The odd time there could be a bit of bruising, but again, not very often. And it's just a very tiny dot. So that's what makes it nice too, that it's, and usually too, sometimes if there is that little bit more, it's a big release that happens. So I always tell them as well that that's sometimes a good part of it, is that there's just all that stagnation or even blood stasis in some of these areas. So it is important to kind of move that and allow that repair process. The other precaution as well is when you are doing some of these points to the neck, like the SCM, you do want to be careful for the large arteries and veins and nerves. So in those areas, you just do very shallow insertion. And again, you can almost lift the muscle to ensure that little bit of safe needling. And again, that bruising and tenderness. I mean, most people usually, once you touch the site after needling, is completely gone. But there's the odd occasion that there may be that little bit of tenderness. So again, it's just a slight precaution and just to notify people. But most often, they, from experiencing other treatments, know that sometimes that happens. And again, avoiding overtreatment. Do not treat too many areas in one session to prevent patient fatigue and muscle weakness. It's easy to get carried away because it is so effective, but we don't want to overload the body as well. So in that case, where then I'm treating the jaw, I will kind of treat through the neck, maybe the upper shoulders, and then through the face. And then that would be ending that part of the treatment, and then save up for the follow-up where maybe I go into a little bit more and into these secondary issues. But that's what makes it nice how these with this non-treatment that it's just a couple minutes, so then they can go on with their day. Or, in cases where I am doing massage, I'll do those certain areas, the big releases, and then I'll go into my regular treatment. And because the tension's released, the massage just feels way better. So it helps that circulation and flow. So this is, I'll just go back for when the video starts.
So with your tension,
Sorry here, 1 second. Oh, there we go.
So with your tension, do you find your jaw?
Sorry, I'm not sure what's happening here. It seems. Sorry.
So with your tension, do you find your jaw kind of clicks?
Yeah. Sorry. So this first person that you're gonna see here, they talk a lot with their work, so they usually have a lot of tension. So I think it's just delayed to the start, but then you'll be able to hear their feedback.
So with your tension, do you find your jaw kind of clicks?
Yeah.
Yeah. A lot of clicking. And then usually that tension in through here. Do you get headaches?
Time to time, it's not as used to be as bad. Obviously, I've been doing your work has been doing great. So, but yeah, sometimes when it's too tense, absolutely.
I'm just going to massage the area in here and find those good tender points in here, eh? Tender? Yeah.
Yes.
Do you find that even refers to the front or just local?
I would say, it definitely have ripple effect for sure.
Yeah, and through here
Yeah,
too.
there,
eh?
yeah, especially your left hand or my right side of the
This
up
one?
there now.
Yeah, okay. So we can feel those nodules in there too, those tight spots, high tension areas. And then right in through here, perfect. So
for the record, I want to say you're the cream of the miracle. So everyone in the city knows you for that.
oh, thank you.
Yes.
Okay. So I'm just gonna find that spot. Yeah, feel that little bit of a crunch.
Yes, a lot of crunch.
Okay. Not too painful?
Not at all.
Bit right there, eh, tender?
Yes.
Okay.
Wow, that felt great already.
Good. And then you'd sit into the side over here.
Mm-hmm.
Oh, yeah.
Oh my God.
Good. Just that really shallow needling. Kind of breaking up those nodules there. Excellent. How's that side? More smooth now? Doesn't feel as tender?
Not at all.
Good. Okay.
Evaporated.
Good. Now we'll do this side. Then I'll just go along, find that tight spot from another crunchy side. Not as crunchy as the right, but does it feel more tender?
Almost the same, but you would know better because you're feeling it.
Oh, that was a good one. Feeling again that bit of a nodule up there. Oh, that was nice, eh?
Yeah, I felt it.
Yeah. Yeah, way smoother down here now.
Mm-hmm.
Do you feel some of the pressure coming out of the front of the
For
face?
sure.
Okay. I always find it's key for jaw stuff to get back here. Yeah, that felt smoother, eh? Not as tender.
Yeah, it feels really good. Like a little facelift. That was pretty
Yeah.
awesome.
Perfect. So same
Oh,
thing.
yeah.
Right in there, tender. You feel that little nodule, again, that little shallow. Go. Another little spot right there.
Wow.
Yeah, the jaw, the big temples are big in here. Temporalis. Smoother now, eh? Not as tender.
Yes.
Don't feel that same nodule there.
No, I don't feel really good.
Perfect. All right. Here, eh? A little tender.
Yeah.
Like you say, the
Yeah,
right
yeah,
side.
the right
Yeah,
side,
that's
yeah.
pretty tight. You can feel the stuff we did back here feels a little bit better, eh? Not as tight, but just that forward. Okay. Yeah, the right side is more of where you feel the jaw pain.
Yeah.
If you want to open the jaw close. Ooh, yeah. Okay. Yeah, you can let that rest there. Yeah, so you can feel it doesn't open evenly, eh?
Yeah, you're right. It doesn't.
So you can feel these really tight spots in here. Again, more nodules. Right in there, eh? It's tender.
Yes.
So I'm just gonna go along this ridge and feel right there, eh? Tender. So just a tiny. Here we go, very shallow. Just enough to feel that little bit of a crunch breaking up those adhesions. Same thing here. There we go, perfect. Yeah, right there. Oh yeah, that was good. Is that really tender?
Yes.
Yeah. Is the tenderness going away now?
Yes, as soon as you touch it, it goes away. That's why you're the king of the miracle. Is everybody as good as you can? I don't think so.
Yes. Now, would you say right there is the worst of that spot, or more into here?
No, the first one.
Okay.
There.
Is that painful?
No.
Do you feel some of that pressure coming out?
For sure. You're releasing.
Now, when I hold that spot there, does that seem like that releases more? Tender?
Yeah, that's the spot, yes.
Right there, eh? Is that more tender or more there?
Oh, yeah. Oh, my God. These ones, when you do it, if the feeling of it is just sensational.
Oh, great. Oh, it feels smoother now, eh?
Yeah.
Right there. Was this side more sticky or about the same?
Nope, same. You're so good at it, it doesn't have to be.
Perfect.
And I didn't get paid to say that.
Now, how's it feeling when you move your jaw when you open it? less crunchy?
Mm-hmm.
Didn't sound as loud when we moved it, eh?
No, for sure. That sounds better.
So with your tension, do you
Perfect.
find
So
your
that
jaw?
was one of them, and this was the next one. Again, she works at the
So
computer,
with your
so
jaw, you get neck
she ends up with a
pain,
lot of
tension
tension.
through the head. Okay. So I'm going to palpate through in here, and first I'm going to find the tender spots. Any that maybe refer into the head. Yeah, pretty tender here, eh?
Yes.
Both sides. Yeah. How's along in here a bit too?
Yes.
Okay. And how about in here?
Yeah, especially at the bottom where you first started.
Okay, both sides?
Yes.
Okay. Okay. So now that we've found those tender spots where you could feel the nodules there, I'm just gonna do my alcohol spray to I find it's key for jaw tension that we need to get these muscles at the back of the neck. So we'll go right to where we feel that tender spot, right about there, eh?
Yes.
So yeah, you might hear that little crunch in there. That's good adhesions breaking up. Does it feel as tender already?
Yeah, it's loosened up a little.
Okay, right there. Okay, just very shallow needling. You can already feel that going down. How's that feeling now? Less tender?
It is, yes.
Good. Great. Okay. You also said you had a spot right around in here, eh? Right about there?
Yes.
Okay. Same thing. Perfect.
And even a little lower.
Right about
Right
there,
there.
yeah. Okay, perfect. Oh, that was a good one too.
Mhm.
Excellent. How are these now? A little less tender?
They are.
Good. Perfect. I always like to check up into here because sometimes, is any of this tender or not too bad?
No.
Okay. Find the tender spot. Right around here, eh? Yeah. Crunchy on that side too. Yeah, right there. Oh yeah, that was a really good one. Do you feel pressure coming out of the forehead and?
Yeah, even down my side, like along the upper back.
Oh, good. Yeah, because that's the other area you get lots of tension, eh?
Mm-hmm.
Bit right there still?
Yes.
Okay. That's what I love about this S-Lon is that you are less tender immediately.
Yeah.
Okay, perfect.
Feel chills going down my leg.
Oh, good. Starting to open things up for you.
Yeah.
Okay. Right around in here, eh?
It's always a spot.
Yeah. Same thing. Perfect. Not too painful.
No.
Good. I find too when we have this tension, just even holding this will even clench our jaw just by that tension. So it becomes like a vicious circle of things tightening. How's that feeling now as I palpate through? Not as tender?
Yeah.
Great. Along this line, eh? Some of them?
Mhm.
Right in here.
And there, yeah.
Yeah. Both sides equal for you?
Yes.
Yeah. If you want to open the jaw and then close. Okay, so at least it moves together for the most part, but you could feel that tension. Kind of the couple nodules on
Oh,
this
yeah.
side, yeah. Really tender right there specifically. Okay, and then right there, right?
Mm-hmm.
Okay. So yeah, we'll give you that instant
Yeah, right there.
movement. Yeah, right in here, right? Okay. Sometimes the facial points can bruise a little bit more. Are you okay with that if any of them do?
That's fine.
Okay. If it happens, you can always put ice on it after. So just the same, just very shallow needling technique. Gonna palpate, find that nodule. Right there, right?
Mm-hmm.
Just very tiny. Not very deep at all, super shallow.
Yeah, right there.
Yeah, right there, okay. You can feel that breaking up, eh? One more there. Perfect.
Yeah.
That one hurt a bit more, but okay.
Yeah, oh yeah, that's fine.
Good. Feel that tenderness going down?
A little, yeah.
Yeah. Still a tiny bit right about there. Oh yeah, that was a good
That
one.
was a good one.
Yeah, you can
Oh,
feel
look
that
at the
melting
difference.
out, eh?
Yeah.
Good. So
Oh,
a
that's a
little
good
bit,
one.
yeah, right there. So we'll do the same. Perfect. You can feel a little something.
Yeah, right there. Oh, yeah, that was a good one.
Yeah. Yeah, some of them sting a bit, but short-lived, right? It's just
yes.
comes and goes. Oh, that feels smoother, eh?
It does, and I feel it going through my legs.
Oh, good. Excellent. Yeah, because once you open up the energy flow, you get it moving through the whole body, especially with these meridians, because they run all the way down to the feet.
Yeah, that's how I feel them.
Oh,
I feel
good.
it going right.
Yeah, you're feeling the exact pattern, so that's perfect. A really good sign that the energy flow is moving, which is what we want to see. Because once you alleviate these restrictions, it allows that energy conduction. So we're going to do the same thing on this side. So I'm going to go along. Oh, this side gets tighter, eh? Right about there. Yeah. So here I'm going to find right on that nodule and just very shallow. Yeah, smoother, eh? It's just instant. Again here. Good. Not as tender now?
Mm-mm.
Good. Yeah. Right about there, eh? Oh, that was a really good one. Oh yeah, so much smoother. Perfect.
It's so effective.
Great.
Yeah, that's right
Yeah,
there.
right about there, eh? So same thing. Just really shallow. Oh, that was really good. Yeah, you feel that nodule just completely dissipate. Not as tender, right?
No.
Yeah, that little tiny bit right here. So I'm just kind of following along and just getting these main nodules out that you can feel are just tender and filled with stagnation. Little, yeah, right in here, eh? Perfect. How's that feeling?
So much better.
Good. We'll just do our last little. Oh yeah, that feels nicer, eh?
It does.
Now, when you open and close your jaw, how does that feel?
Oh, there's no clicking.
Yay! So clicking's gone.
Yeah.
Excellent.
It's amazing.
Perfect. Feels easier to smile.
It does.
Yeah, great. So with your jaw,
Yeah, so I followed up with them after, and they all just felt great. The relief lasted continually, so a lot of it didn't really even go back to being as tight as it was, and the the woman especially found it hasn't been clicking since. So it was really nice to see that not only did they get immediate results, but it was long lasting. So for the after treatment care, I always recommend staying hydrated, drinking plenty of water just to help the recovery, rest and relaxation, incorporating breath work and mindfulness for deeper healing. Again, especially if we're getting into stress associated tightness through the jaw, that breath work is just very integral to allow that process. And again, that mindfulness where we're, relaxing. And again, once that tension's gone, it's almost easier to want to breathe and to feel relaxed. So it continues the process. I do recommend also that light movement, maybe stretching, a bit of mobility stuff, just because once you free up the restrictions, you have that extra range of motion. It's good to utilize it. And in utilizing it, again, you're building that strength and now fortifying the body in the position that it was meant to be in. So that usually feels good. I do say kind of avoid that overuse. I do find with a lot of people, because especially the neck and other areas where they get this relief and they have all this mobility, and it's like, I got to get all my vacuuming done. And they just pile on the to-do list. So then the next day they could be a bit more fatigued. So I say, do stuff, but don't also overdo it, because, you don't want to add additional strain, because you want to allow that healing process. So it's important to support the recovery. That bit of cold therapy, like I had mentioned, maybe a bit of ice if there's the tenderness or if they have bruising. An Epsom salt bath is really nice, helping with the detox and smoothing the muscles and promoting relaxation. One note going back into those videos, you could see how I flush out the area after. I found most people really enjoy that because they get the release, and then you're allowing that, just smoothing out the fibers, so you're promoting the natural course of where it wants to go, so that they can also feel that it's gone, for their own feedback, as well as allowing the body to easily support where things should be. So for the follow-up treatments, treatment frequency, you're generally, you could do every 3 days, once per week, depending on what they like. Some people really want to get after it, so they do want to have a few treatments close together. But because it's so successful, I find I'm typically once a week. Again, if they're going on a vacation and it's like, okay, I got to get on this. So you're not necessarily, even if you see them a bit more frequently, you could treat them the next day if you wanted to, but I find you wouldn't be doing the same exact points. It'd be more following up. So if we release in here, maybe there's some secondary stuff that you're kind of working with. Or again, maybe some of the points that you didn't quite get to, that now that we release the superficial ones, you might be able to almost get a little bit to the deeper ones that you couldn't quite get to the treatment before. So for the expected results, I mean, most patients experience instant, significant symptom reduction. It's been, I hate to say it, but 100% of the cases, it's absolutely amazing. So it's made it nice, as you heard the gentleman comment on, being the miracle, because you want to feel better, and you don't want to take, a 4 to 6 week treatment plan to do it. You want to feel good now. And especially for people with chronic stuff. I mean, God, they've been dealing with it for months. So, like I said, you have that short term pain for long term gain, where, now they're feeling great. So, they might only need 1 to 3 treatments in total for that full resolution of their issue. I kind of have the evolving treatment plan, like I mentioned, because the follow up session may address secondary contributing issues. So now that we've gotten through the initial ones, then we're kind of in that chasing the pain scenario that, might be contributing, if there's, again, we got into that abdominal stuff earlier where, there's these other areas that aren't flowing, that now you can slowly get to another part of the picture as to where this clenching might have come from. Are they dealing with lower leg pain? Are they dealing with arm pain? So it allows for more of an evolved treatment plan, which is always great for people because they can see unraveling through if they were in an accident. They might have, we're treating this, but it might have started with a wrist injury that now resulted into this facial tension that they're suffering from grimacing and just holding pain patterns. So there's that part of it too, which I always remind people that is a natural evolution to treatment and shows success, that we're not going back to the same issue all the time. We're now going into other areas that need to be addressed. So thank you so much for being a part of this presentation, and I welcome any questions that you may have about the Esnan therapy, the acupuncture.
Thank you so much, Dr. Perry, for an exceptional and detailed presentation, as well as for your invaluable contributions to the integration of both Chinese and Western medical wisdom. As we're approaching the end of the webinar, I would like to invite our panel experts one last time to share their remarks and observation. But before that, please allow me to give everybody a reminder to check out on our special offer of Dr. Huang's online video tutorials and the complimentary ebooks available exclusively today. So please check the chat section for the links and further details. And now, back to our experts.
Thank you, Dr. Perry, and for your wonderful presentation. I have two questions. Because I don't know too much about SNAN acupuncture procedures. So does this method have any opportunity for retaining the needle or just instant stimulation?
Well, in my clinic, I just do the instant insertion. And like I say, it might be into the facial ones, I'm more just kind of in out. Other areas of the body, I might do a little bit more where it is into that fan technique. So whether the needle's in for a couple extra seconds. Dr. Han also shared that one of his other students used that similar technique and just left the needles in and had great results. I haven't quite tried that personally myself because it hasn't been necessary to retain the needles at all.
Okay, thank you.
You're
Second
welcome.
question, because in the practice in the United States, we have a standard called clean needle technique. So the clean needle technique doesn't allow to use one needle to insert several spots. So, but it seems more difficult for you to provide a treatment for those kind of technique. So I don't know, probably in Canada doesn't have this kind of thing.
You said don't try to knock on the door? No, no. No, not at all? No. You can take picture basement. Basement? Yeah.
Yeah.
And then, could you go in there and take pictures for me?
Sorry,
Not sure what happened there.
That's happened
Sorry, I edited
someone
the
forgot to
video,
mute
so
themselves.
sorry, I edited so you don't see the exchange of needle that's happening.
Oh, you can change
So,
needle. Okay, sorry. Okay.
yeah, sorry.
You can change needle. Okay, that's great. That's great. That's my concern.
Yeah.
Okay,
Yeah,
thank you.
sorry. We're trying
Thank
to
you.
shorten it down because it was a long video. So
Okay. No problem. Thank you. Thank you so much.
you're welcome.
You're done, Dr. Chairman. Thank you. Hello.
Hi, Dr. Hong.
Hello, everyone. I'm Jason Howard, the president of Neuroacupuncture Institute in America. Kimberly Perry gave a wonderful presentations and very impressive and good results. And a few questions. The first one, something two patients you gave is all neck tension related. And in the clinic, quite often, like you talked earlier, the courses for TMJ there could be many different reasons. It could be stress, a lot of time is digestion related. Do you address the cause, pathogenic factors, and same times or afterwards, or you thinking the local treatment very effective, it resolve everything?
I appreciate your question. Yes, it depends on the case for sure. So if some of the patients, if I know that there is kind of a deeper underlying factor, I definitely incorporate some of the traditional treatments with, the more distal points that would help with digestion and just rebalancing the energy flow, as well as targeting the local sites.
Wonderful. Second question, so sounds you approach many different points. Like a TMJ on the face area, usually, generally speaking, how many nodules you're able to palpate? And so what do you feeling under your fingers, the nodule on the face?
Yeah, it's usually kind of that high tension. So depending on how severe their case is, there might have, those ones in particular had quite a few. Some people might have only one or two. So then I would kind of get those ones, but you feel almost like the ball kind of within the tissue itself. And again, it's very tender, so you're looking for that tender nodule. Yeah.
Wonderful, that's great. Thank you. And
Thank you.
doing that, there's a lot of TMJ and many different reasons. Some Chinese medicine produce wonderful results. As you know, and in the North American, even the Europe, the patient get most of the patient is an inpatient. They want instant release of some of your technique from Dr. Wang, wonderful results. So it's wonderful introduce and integrating your technique with traditional acupuncture treatment, and the life of acupuncture is a result. So it's a key. So we see that. We're excited about that. Congratulations for your achievement. Thank you.
Thank you.
Hello, I believe the Kimberly, you have done the very good presentation. Not only your details explanation and your video to show all of the your treating procedure, and also during your explanation, you always to give the anatomies photos. This is very useful. Let me understand what you're talking. It's much details because you can integrative the traditional Chinese medicine series and also anatomy can making your treatment is more currently. So this is where I believe your presentation excellent.
Thank
And
you.
also, you are today is the first person to show your whole treating principle, treating procedure. And also, I recognize your integrative, your massage with this SNAN treatment. So, and also your massage can be like your diagnosis, the which troubles muscle and nodular, and also after treatment probably help you to massage to avoid to bleeding happened. So probably is this massage integrative with the SAN treatment is very useful. And I recognize others. You treat the TMJ is from the neck side and also for face side. I also believe this is a very good treating principle. My question is similar than Jason. You understand? You answer already. Thank you ever so much.
Thank you.
I can't believe.
And I was going to add one extra thing that I really appreciate in the training I did with Dr. Huan is he really integrated that massage aspect in the palpation before treatment.
Same than Jason.
So it gave the confidence in that of really applying that to the treatment to make sure it was extra effective.
Totally agree with you. Congratulations, Kimberly. Great.
Thank you.
Presentation. Number one, Dr. Jiang mentioned about that the presentation with great detail of anatomy, which help everyone in the conference. At the same time, it shows that Dr. Huang's training is superior. What
I agree.
he presented with all the anatomy and neurological knowledge is amazing. The second, when you present the presentation, it's so crystal clear. I would definitely recommend you suggesting provide a community presentation so you can educate more people and also gain more clients.
Thank you.
Yeah. Another things I would like to see is that so your instruction actually shows that your skill is high level instruction, which again we appreciate Dr. Huang. Amazing training from your technique, your knowledge, and for myself, I'm grateful. I'm a professor. I'm teaching students as well too. So if my students or my practitioner present in your way, I'm very grateful. And I think Dr. Huang is very successful. Thank you for sharing technique and your technology. Thank you very much, Kimberly and Dr. Huang.
Thank you.
And Dr. Zhou, you are still there, right? Zhou Xiping.
Creo que tengo un problema en el piso donde agarre, ¿no? Sí.
Yeah, do you want do you have some words to say, Dr. Zhou?
Dr. Huang, can I require a question to you?
Sure.
Do you thinking is this as NAN treatment better to do like the came to just point, or put a needle in, hold on for a while? Which one better?
Of course, that I'll say that the sling acupuncture is better than you stand the needle inside the body, because I say this technique is based on that that our the modern that the knowledge and the research and it's not from the traditional that thinking or series from meridians. Okay. So from the traditional meridian series, we need to put needles inside and then to attract the qi, and then that to make the qi flow and the blood flow going better. Yeah. So this is of course from these techniques, because our treatment target is very objective, because we know it is kind of nodule, the tender nodule there. That's called the problems. So we directly just target that to treat the targets which cause the problems. So that's why that this is kind of direct treatment, to treat the cause of the pain, not like traditional acupuncture treatment. We insert it in one point and then to treat some conditions, because to my understanding, some points typically for the pain issues, they don't have exactly that correspond, that relationship. For example, 合谷治头痛. Lots of people will do that, okay, when treat the headaches. But what's exactly the relation of the 合谷 and headache? Nobody know. So when we put needles on the 合谷, maybe get a result, maybe no result. That's why that I say from sling acupuncture, so we direct from local, we find this kind of tender nodules, and patient's response tell you right away, oh yeah, big release. So that's why that I say, just like that if we have a shortcut from, for example, from that Canada to UK, if we can take fly go to the UK, why do we have to take the ship? From ocean, that takes 2 months go to there. maybe a flight, maybe around 5 hours, go there directly, go there. So that's why the series is based on my research, because I found traditional for pain treatment. It is quite, that lots of question marks there. How to identify the pain? What caused the pain? And then those nodules and scar tissues, how can we to remove those kind of nodules and trigger points and scar tissues? Because scar tissues is kind of, and the collagen-based, that fibers, right? Just lock your muscle. That if we don't use these techniques, how can we remove these scar tissues, which could be cause big issues. That's why I think Dr. Zhu Hanzhang invented, the Zhendao Yixue, because he found the scar tissues, the big issues of the soft tissue pain. Typically for with, he say, in intact pain, that is very hard to treat with regular acupuncture treatment. That's why that, since 1970s, the Zhendao, acupotomy has been very popular in China, because it can resolve lots of problems which the traditional acupuncture can't resolve. And also more accurate and objective, I say, oh yeah, it is the problems from this kind of scar tissues. We just remove it, and then that's it, just like surgeries, right? We don't have to, guess. Oh, maybe this point works for headache. Maybe this point is good for shoulder pain. But when we put needles inside, maybe that, that the needles depends on how deep you want to go. Directions. Do you need to chi or you don't need a chi? And then when you get a chi, the result is good or not good, because all these issues, all question marks. Nobody can tell me exactly what happened of the pain treatment from this point. That's why that I feel this more direct, more objective, more precise to treat pain issues. I mean that advantage is much better than traditional, acupuncture for the pain treatment. That's why that I want to address here. And here, anyway, that I really enjoy that, Kim's presentation, because typically that, his videos, because from first two persons, maybe your professors, maybe you don't know how to perform the sling acupuncture treatment, but from her video, you can tell exactly our technique. Very quickly, to pick that kind of trigger point, tendon nodules, and then patients feel right away the result. So that's why that more, I say objective, and also more that, that direct. That's why that I really that, that like her that video. And also I really that like, that conversation from her to the patient, because he always instantly get, that the feedback from patients. How do you feel? Do you hear crunching sounds? Right? And then that how do you feel that, tension now? How do you feel tendon now? How do you feel muscle now? Yeah, the patients give her right away, response. That is much directer than traditional acupuncture. We just leave the patient on tables, put needles, stay needles inside, and after 30 minutes, patient get up and then ask how they feel. That's only one word after that. Maybe getting better, maybe not getting better. If getting better, maybe we don't know how is the patient getting better. If the patient is not getting better, we don't know why that doesn't getting better, because we follow our traditional, the differentiations, and then we choose the points exactly as our, the textbook, told us. But from this way, we can instantly get, patient's response, and then we say, oh yeah, that's right way. So if we can't get the direct result, why do we have to go to indirect way? That to guess, what we should do. Okay, that's my point. And also that I think that the Kim is awesome, because that time, actually she just learned from this last October, last fall, right? August, yeah. And then that, only not even 1 year, she has been ordered, that more than 30, that box of the needles, that for me, I'm surprised. I say, why? You use too many needles, that because this needles quite, that, we use one patient sometimes just a few needles, that's enough. But she used lots of needles. So, and then that I asked her how to feel. Because that time, I don't expect, that because that time our class had almost 15 students. I think that she used of the, most needles, that of all. So that's why that I'm very impressed, that. And then how to feel like, this techniques. Oh, I really enjoy that. It is the game changer, that I totally right on use that every day for my patients, and all patients like it. So that's why that I think this is the way that I invite you experts, come here. I want you understand because I know you are work, that outstanding, that the professors and the scholars, that for acupuncture, that treatment. But I think this is a new, ideas, new, that new way to manage that, the soft tissue, pain issues. I hope your expert can, that understand more of this kind of, that series and techniques, because this is not, my own original that, technique. I mean that originally I absorbed from that, that acupotomy, the 真道医学, and also from that my fascia, that trigger points, from the doctor, Janet Travers, that from, so I absorb their knowledges and techniques, and then that, combine that this kind of special, that the needles, that we call blend needles, because I found this needle is more effective than traditional needles if we do the same techniques for the patient. Yeah, typically to release those kind of tension, of the nodules. Just like in Chinese way, we always say, 气开排脓, right? Why we use a blade to, to release that, because it's more effective. Then you just use regular needles, punch that, the cyst, right? This is the way just a little bit blade, more effective.
You're
to that.
meeting.
And also that from the heard the videos, we can tell, that the techniques, that from patients, that seems patient very comfortable and almost no bleedings, almost no that, complaint, that the pain, and also the techniques is very, very shallow. So that's why I say this techniques is very safe, very effective, and then that, I mean, no any risk at all for that, for this kind of a treatment. So that, yeah, thanks again for the Kim's that the very, that the very, very wonderful the presentation and the very impressive, for your videos, and then not those kind of, that our audience and experts, to know, how to exactly to perform, these techniques, so that's why that I really appreciate the presentation.
Thank you so much, Dr. Han. And I realized half the time I was motioning my thank yous to all the experts, my video was off. So thank you all. I really appreciate your positive feedback. And again, I feel honored to present in front of you. So thank you.
Yeah, thank you.
And thank you again,
Thank you.
and Dr.
Thank
Han,
you.
for just the knowledge that you've shared and really help accelerate treatment possibilities for us all. Thank you.
Great technique.
So Dr. Huang is very good. It's not his knowledge and experiences make a complex disease treatment so simple. That's the best about a good professor. You can have that create the invitation to use in your practice. The best part about you, you can teach that very effective, efficient, and your student can make a good repeat the results. So it's the wonderful result. I have some question about you, Dr. Huang. You talk about face muscle twitching spasm. It's the most difficult treated condition. So the patient you treated, you can find nodule there. What is your technique? You mostly talk pain, nodules, pressure, tenders. How did you approach? And what is the long-term result for that?
That is very interesting, though, that because before I thought, of course, that we all believe that is kind of, that the nerve, the motor, that the, issues cause, that muscle, twitches, on the face, the patient is very uncomfortable, but patients never complain any pain. You know what I mean? So the same thing to me, I never expect, patient have the pain or tender on those muscle. But that day when I just, that pipette it, and they say, use my fingernails, actually, I say, just those kind of very twitchy, where your worst, one, I just, touch it. I say, do you feel tender? Say, yeah, very tender. And then I try to different part of those kind of twitch muscles. They all told me, this muscle is very, very tender. That's why, oh, that is not just nerve issues. Also, muscle itself has been that, impacted. That's why that I just, use my, that nails to, to touch it. Some conditions, if they're very superficial, we don't even have to find the exact nodule because sometimes the nodule could be very, very small. Like sesame, seeds, very, very small. So that's why that for this kind of issues, you just use your fingernails, to touch it. If you're very tender, just under your fingernails, and then just insert it there right away, in and out, very quickly, even not 1 second. And then that choose another muscles, which is very tender, and then underneath of your nails, very tender, and put it in, and then in and out. That's it. So surprisingly, the results so good. And another, that the case I want to share here is that we have also kind of tremor, not from Parkinson's tremors. We have that we call essential tremor. Have you heard about that? Essential tremor? That means that the doctors don't know what caused the patients of the tremors, but the patients, that they always, shake the hands, shake the arms, that they don't know how to treat it. That also that I thought that could it be that maybe muscle cause issues because the doctor ruled out that from that, Parkinson's. And then I just looking for those kind of muscles from the triceps, biceps, all that, that deltoid muscles, all kind of wrist extensor and the flexor muscles. I found they have lots of tender nodule inside. And same thing, I just use my thin needles, just, the pink out those kind of, break up those kind of nodules, the tender nodules. The second day they come back, the arm is very calm, almost no shake at all. So that's why that I say, not so, from my practice so far, I found lots of things, that, yeah, of course, it's a game changer. Because that I found, trigger points, it is kind of great, that the invention, for soft tissue issues, which not just impact the soft tissue itself, also maybe affect, that the nerve systems, endocrine system, that even that, that the ENT, eye issues too. So that's why that I say that we need to open our eyes and then to learn this new knowledge and new technique because it is very helpful for us to help more patients in the clinic. I used to treat one patient with eye issues. She come here for neck and shoulder pain, but she say because right now she's a disability, she can't walk at all because her vision is almost blind, or right eye vision almost blind. But that time I don't care about that. I just treat her neck and shoulders. I treat all the on these areas. After 2 sessions, the patient come to tell me, doctor, my vision get much better. I said, really? Yeah, I can see something now.
Dr. Huang, can I require the question?
Sure.
Like you said, this trouble is very shallow. But if example, one of the very fat person, the Western, very big fat, a lot, very fatty lady or man, but sciatic pain. If give the shallow needles can work for the deeper place.
That yeah, answer your questions are true. That also very interesting. Some patients, that yeah, I do have some patients, very very big person, the big buttock, and then that yeah, of course, traditionally we use 环跳, we have to use maybe 3 inches, maybe 5 inches go deep, but most of the time, because our traditional, the training, yeah, we are always looking for acupuncture points. Okay, we never, that pay our attention to touch patient's skin, the fascia. But I noticed that when patients come here for sciatic pain, actually, if you touch the skin, you can tell the pain part. Most of the time, pain part, the skin, the fascia is harder. The tension is high. So if you just use the slant needles, just 1 centimeter deep, just break up those kind of very hard tension part. When she get up, he will tell you right away, my pain is much better. That means that patient tell you the pain, he feel the pain, maybe feel deep, but the source still very superficial, very superficial. But our training, we never, pay attention for the, that skin and the fascia issues. We always think because sciatic nerve pain, because the sciatic nerve has been compressed by, for example, that the for some muscles has been that, that compressed. But actually, no. Some cases, no. So we have to, use our hands. That's why I always teach my patients, my students. I say all our treatment, all our, the treatment pocket is under your fingertips. When your fingertips find those kind of nodules, find those kind of, high tension, either way from skin, from the fascia, that's your treatment part. You don't have to go too deep. Yeah, maybe that that this because I do lots of research, lots of that practice on my clinic. That's why that I can easily to express my opinions. Okay, so that I do have one patient before that come to my clinic. Actually, he come from BC, Vancouver, and of course he has been treated in many sessions in Vancouver because there are lots of very good doctors there too. But come to my city because of just visit, and his low back pain exactly on SI joint. Okay, the pain is very bad, but when I just check, that his that the waist areas, that SI joints area, the skin very cold, and the skin the texture is harder than normal skin. So just that you use my needles, just prick those kind of that hard skin. And then when he get up, his pain is 90% better. So that's why that I say our trainings, our education from our textbook, always taught us something could be very deep. Actually, lots of things. I say maybe at least 70 to 80% of the patients, conditions, pain issues is very superficial because our skin is most sensitive tissue of our body, right? We have itching, we have burning, we have pain, everything is more sensitive than our muscle. We should understand this point. Okay, lots of pain from your skin, from a very superficial fascia than the muscles, because muscles actually is very big muscles. They don't have too many the sensor than our skin. So if we pay attention on skin, on superficial fascia, and then you will find cause of the pain. And also another issue is that we say we also that by analysis patients that the function movement. For example, if we find maybe the deltoid muscles or bicep muscle have issues, the insertion and also that the origin part usually around the joints beside the bone. The bone is very superficial. So you're just looking for the bone size for this kind of muscles insertion on the origin part, and then you then need to break up those kind of that scar tissues or trigger points, and the patient pain will be getting better right away. Yeah, so that's why that I say that I would like to update our some knowledges for the pain. That assessment, diagnosis, and the treatment. I think that for the pain issues, we can, to jump off our that original, that issues from our textbook. We should have a new idea, new that technique, and then to treat the soft tissue pain issues. Okay, so that's my comment for Kim's and yeah. So any more questions from all our audience or no? Let me see. Okay. Okay, so that thanks again for those experts that come from UK and States and give us very valuable, that Dr. Zhou Xiping.
Yeah, thank you. Yes.
Please, yeah, I'm waiting for you.
Oh, thank you so much. And Kimberly did a great presentation, and she's very in detail. I like her also talk about so how details use the Dr. Huang, your special needles do, the technique, work on the TMG, you know, work with different angles, work on that, and like you know, Dr. Ye Mengchen, you know, the President Ye Mengchen said is in the USA a little tricky. We do is, you know, likely illegal. We cannot do the special needle, but it's the method, you know. And last week I was with Dr. Huang, and after that, you know, the lecture from his students, you know, I use something at home. It's very effective. And I already applied to my practice. Is even use regular acupuncture needles, just 32-inch and 2 inch long, 32 gauge. So it's 22 to 25 millimeters. Works very good. So I that I feel is to all the audience, we can really use the Dr. Huang's this special developing the technique and series work on any acute and chronic conditions. You know, it's very effective. But it's meantime, you know, it's like Kim. You know, it did combine some, you know, trigger point massage, you know, muscular massage together. But even copy, I think, will be how together have even more better result. And it's really, I saw Kim is very thorough presentation, and but I learned also from last week and this week from Dr. I learned so much, and also here the expert, you know, Dr. Chen and you know Jason Hall and our another expert. So I learned so much, and please give me the time to attending this great little conference and learn so much. Thank you, Dr. Huang.
Thank you for your comments. You know that at last point, I want maybe just maybe that one tech just one point I would like maybe that advise our experts. You know that here. Because from 1970s, you know that the first time, you know that after Doctors Dixon's, you know that with China, that bring the acupuncture to states. That's the first step of our acupuncture in North America. I think right now that we should go to next step, you know, and then that, you know, to do more things than before 1970s, because I think right now, if we have a better solutions for my patients, why do we still have to stuck in that old policies from the, you know, that from 30 years ago, 40 years ago, you know, we designed those kind of policies, you know, so that's why that I think we need 与时俱进, you know, go advance with that, you know, that updates, right? And also, as 邓小平说，不管白猫黑猫，抓住老鼠就是好猫。Whatever is a white cat or black cat, as long as you can catch the mice, is that you are the best cat, right? So same thing that I think that our policy designer, you know, that should, you know, think about that, you know, to update our policies, you know, for acupuncture. And even I just noticed that, you know, even 10 years ago, our acupuncture therapists in North America, you know, that have that anti-dry needling, you know, that the campaign. I think that we should open our mind, you know, to learn something from there, because you know, don't believe that because dry needling also that is specifically for the pain, you know, treatment, and if it works very well, why do we have to against the dry needling? So that I think we should also learn some from the dry needling as acupuncture therapist. We should have those kind of, you know, our, you know, that you know, the mind, and also that, yeah, so that's my that you know, that suggestions, you know. But anyway, from the Canada, from our that you know, the province, so far, you know, practicing for this contact links, I mean, no any issues happens, no any side effect happens, because you can imagine only that 0.3 millimeter, just 3 millimeter, you know, what the risk could be, you know, that, I mean, much safer than that you need to insert, you know, that 2-inch, 3-inch, 5 inches deeper to your body, right? So, and also we work only on skin and fascia. So any risk? No risk at all. So that from Kim's, you know, the videos, we can tell, you know, that's so comfortable for the patient, for the therapist. So why do we have to against or reject this kind of new techniques if it works very well, it's safe and effective. So that's why I would like maybe to have this kind of promotion that for the lectures, to introduce our slang acupuncture. Okay. Dr. Hao, do you have any more comments?
Yes, Dr. Huang, I would like to have a few
Sure.
words. Sorry, that so I attended your conference in Canada during Thanksgiving last year.
Oh yeah, yes.
And your presentation was very impressive, and your students. We actually we have a lot of attendees breaking into your group.
Yes.
The response, the feedback is amazing. So I'm 100% to support your technique. And today is a different scenario from your students or your practitioner, your trained, what they present with their confidence, with their knowledge. So I will say definitely I'm gonna give you 2 thumbs up. Fantastic job, Dr. Huang.
Thank you. Thank you.
And absolutely we should learn this technique and expand it. Thank you very much again.
Thank you.
It's a very good conference, and I learned a lot, very encouraging, and also think about I need to invite you come my institute, introduce your technique to our student, and we treat a lot on neurological disease and also clinic, as you know, is still pain related. And I do scalp acupuncture most, but your technique is very impressive. It's wonderful, and you can share that, teach that, you make that simple way, and your student can repeat and get good results. It's most valuable for today's conference. Thank you. Feeling honored to be here and looking forward to learn from you as well. Thank you.
Thank you. Thank you. Okay. Janet 老师, do you have more comments or no?
Yeah, thank you for Dr. Huang. I believe you are developing kind of the innovatory and revolutionary new technology from our ordinary acupuncture. Thank you ever so much.
Thank you.
Dr. Huang, thank you so much for your innovation, and I learned a lot in the class, this seminar. Maybe you already accumulated a lot of effective cases, and from your students. So I believe will be the next step. We can try to design some control studies, or that's because evidence-based medicine now all required for this.
Yes.
So it will go to more advanced, and at the same time probably do some kind of research for biophysics or something, the mechanical research that will make the SNAP acupuncture be great. Thank you.
Yes, thank you very much. Yes, thanks for your suggestion. Yes, I'm planning to do that. I want to make, but I have to design that that the research project, how to do that, because typically for clinic, the research, lots of that factors, that could be, that interrupt, that research result. So that's why that I guess we need, that maybe very, very, very good design, and then that for the research project, and then that I do believe, because this techniques, that is much better than traditional acupuncture for pain management. Because sometimes I use my traditional acupuncture treatment for my pain treatment, and also compare this my treatment. I say so far 100% patient back to me, doctor, I still want you to use that we call spicy needles, a little bit spicy, because it works very well. That needles insert in the body 30 minutes, that after a few days later everything back to normal, almost not too much changes. So that's why that I can tell that why and Kim when she learned that my techniques, and then so excited because I believe she maybe have same that the experience of feedback from her clients, I guess. That's why that I think Dr. Chen's suggestion is very, very valuable. That I would like to do that in the future. If we can find some very good clinic, compare. I don't mind to compare to the physio clinic or regular acupuncture clinic. Yeah, we can looking for some kind of issues like migraine headaches, like that so TMJ, and also any kind of soft tissue issues. Yeah, I don't mind to have competition. That is very interesting. Okay. Okay, so that's my comments. Okay, Johnny, that I guess maybe the time is up, and then we can maybe stop today, end today the lectures, because Dr. John's time maybe around 9 o'clock already.
Okay, so thank you everyone for joining us today. And I hope you found the discussions on SNAN acupuncture both informative and inspiring. So it looks that we don't have any further question from the QA section, except the one. There's an anonymous attendee who's asking if there's a specific bladed needle and gauge that's recommended. So I would suggest you to email Dr. Huang directly for the question. So yeah, that's all. I think it's time to wrap up this session. So thanks again, everyone.
Thank you. Thank you.
Have a nice day.
Have a nice day.
Yep.
Yeah.
Okay, bye-bye.
Bye-bye.
Bye.
Thank you.
Thank you.
Bye.